it has been impossible for me to get adequate pain medication and adequate sleep medication. Now the pain medication, I understand the stumbling block. Well, it's also related to the sleep because they're prescription, they're narcotics. I was on lorazepam for years, I self-monitored, everything was fine. I got here 2 years ago, they took away my lorazepam. And I was on some regular pain meds I could take as needed and take about maybe 6 a month. They cut that off. And the reason is because of the opiate scare.
Right.
Is ensnaring people like me. And the only thing they will give me is antidepressants. And I say, I'm not depressed. I mean, I'm not happy about no sleep and living in pain, but I'm not depressed because of that. I would just like to get some decent sleep every night and be out of pain. And I can't get anywhere in the women's clinic. So I think that needs to be addressed because we're getting caught in that net of people who have been addicted. And I understand it is a problem with the VA because of the pain many people have because of their service, or they are in pain. So I understand where it's coming from, but it's unfair. And I've been through a 2-hour pain examination clinic, and they confirmed that I was not an addict, and I should get, or could, they recommended 10 hydrocodone a month.
Oh, that raises another question too that I hadn't thought about is BTI, traumatic brain injury. I had a friend who was diagnosed with post-traumatic stress and years of problems, alcohol, all kinds of problems, drug, ended up going through therapy and then got re-diagnosed and with traumatic brain injury. And it changed the whole chemistry of his brain and the way he was thinking about things. As he started going through the right treatment, it actually helped him, and he's doing tremendously better. So that finding the right treatment is also, for me, that's also an issue I have because I had explosions go off behind me, and my nephew, I just took to PRA, a clinic out there for traumatic brain injury. He's there from 9 a.m. to 5 p.m. today, going through tests and stuff. But he had a board fall from 4 floors up and hit him in the head, and you would think he's normal, but he has these problems. He was being tested for his eyes not coming together at the right time and one eye shaking and blurring. And when he was going through the test, because I'm with him most of the time, I said, let me see this test. And so I was looking at it, and as his therapist was looking at it, I says, well, I don't see it either. And she goes, are you sure? And I says, yeah. There it is. Oh, now it's gone. She says, maybe you should get rechecked on that, So, just things like that was by accident, So we don't know what we're missing sometimes, and I just want to make sure that that people over a period of time get rechecked or reevaluated, so that as we grow older and other problems may show up that we weren't aware of, and new technologies. Oh yeah, new technologies. Where are we going with that? Mammograms. My wife said that she did 3D or digital mammograms, and how that is available.
Okay.
So we'll let you talk to this.
I'm going to pull up a website too, because like I said, one of the things that I'm hoping is to also get word out about the women's health program. So I'm going to take a step back and kind of go broad here for a moment.
Sure.
Okay. So women's health programs in general across VA are a new-ish program. I'd say here at the VA, this is not an exact number, but I think we've had a program in existence for the clinic itself, actually, this is a Monday morning, is it
Mm-hmm,
not? Okay.
mm-hmm.
When I say the women's health program, I'm talking about something separate from the women's
Clinic, right.
Right? And so the women's health program has been in existence longer than the clinic has been here, okay? But not by too much. Okay, I'm gonna go to the public internet website here for Portland, because we just updated our website. So, if you go here to healthcare services, there's a section that says women veterans.
Mm-hmm. Okay.
And then this is our current team. So there's me, Women Veterans Program Manager. WVPMs, every VA healthcare system has one. So we have multiples here for Oregon.
Oh, you do have multiple for Oregon, so,
Mhm.
okay.
Yep, because our Portland VA covers 12 sites in the state, but there are maybe 3 other healthcare systems in Oregon. So then we have a women's health medical director, Dr. LaFavor. We have a women's mental health program director,
Mm-hmm.
Dr. Cole, and then we have a women's health navigator, that's a nurse, named Megan Kaufman. And then on this website, it has some general information about how to connect to our services. And then once you get to this image here, everything else at the bottom is national information. So everything above is local information, below is national. So if
Okay.
you go to other VA websites, they'll take you to a similar place.
Okay.
The top will be changed for the local information. But my contact information is here on the right-hand side and here. But this has some general info. I think it might say in there. I don't know. Let's see if it's open. No. So the Women's Health Program is really tasked with removing gender disparities within the VA healthcare system.
Mm-hmm.
That's really one of our big goals, and to be a genuine leader in healthcare, and
Right.
particularly for women veterans. Now, I believe in the VA. I've been working here for like 13 years, and so clearly I think the VA is a great place. And after I started here, now I'm taking a bit of a personal digression. I'll return to the women's health program. After I joined here as a psychologist, so that's my background, that's the lens which I see things. I'm a trauma therapist. I joined the Army and I deployed with a medical detachment doing mental health. I'm now out, but I was a reservist for a bit. So there's also a personal passion here too in being part of the women's health program. And I'm not the only WVPM that's a woman veteran in our Pacific Northwest. I want to say Alaska might be our other site. Anyways, so that's kind of broadly the women's health program we want to keep an eye out for. Women veterans broadly, reduce gender disparities, improve our care in general. Some of the things that you all highlighted are areas that we really do want to address. And so I want to kind of talk about it a little bit.
Sure.
Because we have primary care, which is one of the biggest areas that women veterans connect to, the primary care services, right? And primary care is available at all 12 sites of our care. And I'm going to go back to this internet site, because if you go to location and directions and community clinics, right, this shows you all the places that we have a VA footprint. This is separate from the hospital, the Portland Hospital, and Vancouver, because those are 2 larger campuses.
Right.
So we have those 10 locations. Anyway,
So these are your primary care areas,
we have
clinics,
primary care at all of those sites.
Okay.
And we have what we call, and I shouldn't say we, nationally, VA has a designation for primary care providers who provide women's health care. They call them designated women's health providers. And we have those providers at almost all of those locations. We have them at about 10 out of those 12 locations. So we have, in most of those clinics, primary care for women and men is integrated in the same clinic. And within each clinic, there are multiple providers that can provide women's health care. And really what that means too is a woman wellness exam, so an annual PAP. It's not really annual, now they've changed the guidelines, right? But
Yeah.
that can happen with your women's health provider during a primary care visit. You don't need a separate gynecology visit, right? So that can happen at all of those locations. My voice.
For mammograms, we contract with the OHSU.
Yes,
They do
well,
very well.
they're one of our, oh, good.
They're
They're
very
very good. So we have quite a bit of our gender-specific care is community care. Mammograms is one of those things. That's not true for all VAs. That's true for our VA. There's not many VAs that do in-house mammography, but there are some. And ours does not do in-house mammography. And so, let's say like in Bend, you're probably going to go to St. Charles, Vancouver. I want to say it's Epic.
Yeah, the woman that was raising that issue was out of New York, and she wasn't getting it, and she was very upset about that. So those are, that was one of the issues that she had raised.
Yeah.
So
that makes sense.
And then so you're nationally, she wanted to know nationally how. The machinery was available. I looked it up at like $500,000 or something like that for the machine. But how that would be used in the clinic, and if this is continuation, how are the VAs going to be setting up having that available for various hospitals? She was raising those issues.
It's a really important issue.
Yeah.
We're lucky here in Portland in that we do have such a natural partner in OHSU.
Right.
We hear that they do it well. And so we want to use those partnerships where we can, but then that's not true across
The
all
nation,
of Oregon.
yeah.
And the nation, and we're aware, right? So, just to go back to this, so we have primary care, one of our biggest partners, right? And women's health care there. So that's one model of care that VA provides is integrated care within other primary care clinics for women and men. On our campus, we have the Standalone Women's Clinic, right?
Mm-hmm.
And not all VAs have a Standalone Women's Clinic, but we're lucky to have one, Center for Women Veterans Health. And a Standalone Clinic has different criteria of what they need to have. So they need to have designated women's health providers. And you're right, for quite a while we had a provider. If that, there was a moment where we didn't have any actual providers, right? And so that has really shifted now. We are currently at 5, and we have multiple providers that are available. We are seeing more people than we ever have. And the women who are our providers in the women's clinic are heavily invested in women's health. They're passionate about it. So they're
You have female gynecologists in the
so that's one of the other requirements of a standalone clinic.
Okay.
Is that it has gynecology on site.
Okay.
It needs to have a women's health pharmacist on site, social work, mental health provider, and a separate and distinct entrance and waiting area. So those are some of the criteria for a standalone women's clinic. And ours is situated alongside the primary care clinic. They kind of are right next to each other, but separate entrances and that sort of thing. Is there more that I wanted to say about that? I can't remember. Okay, so that's the state of primary care right now with our women's health providers. And like I said, we have double-digit designated women's health providers for all of these sites of care. And part of that is because we want women to have options and to go to a clinic that either is convenient because it's close to their house, or if they would like a separate standalone clinic space, that's available too, right? So we want just women to have options. Some women want a standalone clinic, some women do not, We hear good things about, I'd say almost the only places we don't have women's health providers right now is Newport and Lincoln City. But all the other locations we do. We're really lucky, But getting word out about that has been important for us, So, okay. what else did I want to say probably?
Well, that would be good if we were doing a program together, an educational,
To get the
inviting
word
people.
out.
Yeah.
Here on our website, for people wanting to connect to primary care, calling this number, that the team that fields these calls, what they'll be asking is, where would you like to be seen? And offer the women's clinic if a veteran wants specifically to be in that standalone clinic. And that's the process. The other big partner we have in the women's health program is our mental health program, right? And that's an area that we're looking to expand as well. Same thing, we want women veterans to have options, right? We have some of our groups that are co-ed, and we have some groups that are women only. And that's an area for sure that we've been wanting to expand, because there have been slim options in the past, right? So we have a women's mental health work group. They put together this flyer here about how to connect to women, to mental health care specifically for women veterans here in Portland. And so we were able to get it up here. Anyways, so all of the folks that are passionate about women's mental health care, they don't work for the women's health program. Again, the program is more oversight to reduce those gender disparities and support the work that's happening across the board. So mental health is a big partner, primary care is a big partner. But some of the other things that you're talking about, like physical therapy, cancer care, specialty care, all that we're doing here in the hospital, that's another area that we try to partner. The women's health program tries to partner and sort out what are we doing to help out community care, because so much of our care happens outside of VA. Mammography, maternity care, those are big areas for women veterans that right now are non-VA care options, okay? So, I lost my train of thought about that, but.
Well, the question there would be, like I said, Agent Orange, right? So women who have been exposed to burn pits and other chemicals that could cause birth defects, how is the VA caring for them as a family and their children? I mean, they still didn't recognize my child. I'm still fighting those issues for male to be recognized for Agent Orange. In today's, 2019, they only recognize spina bifida. We have a bill in Congress to recognize males equally with women with all the various Agent Orange anomalies, diseases that are coming. So, but I also work with a group called the Children of Vietnam Veterans Health Alliance. And these are children that were born with anomalies and who are about 4,000 strong on their own website, and they all had male veterans, fathers, Vietnam veteran fathers, and they are the ones that are speaking out. And I'll be in a workshop with them in Spokane. I've been on a workshop with them before. So when we go through the veteran VFP convention, I'm on an Agent Orange panel. I'm also on Save the VA panel. So those are issues that we're working on. So I'm real concerned about that.
Sure.
Sure.
And I think VA, I'd say in terms of how VA is addressing it, I can't speak, for big VA and that sort of thing. I'm more speaking to my slice of the pie. But I'd say, my primary care partners, they're doing their end of things to make sure their providers are trained up in understanding the disease process. And historically, I think VA, big VA, seems right, it has been incrementally moving towards acknowledging a variety of different disease conditions, right? And we've seen this with like the Agent Orange, just registry and building it and acknowledging it and validating, or Gulf War syndrome folks, right? I know when I returned from Afghanistan, getting on a registry, and right now it means pretty much nothing
Right.
in terms of any care or anything I receive, but I wonder, well, will this also be something that translates later into some acknowledgement,
Right.
noticing, so many of the folks I know that I deployed with, and myself included, have thyroid cancer. Is
Right.
it connected? We're not
Right.
sure. So we've got things that, I know that there are these possibilities, and
Right.
I know that as a field, my colleagues are training up and making sure they're doing all that they can on their end, but you've got the healthcare side of things and the benefits acknowledgement side of
Right.
things, right?
Yeah.
And sometimes there are independent processes that
Right,
happen.
I understand that, but I think it's important for those in the healthcare provider situation to pressure them
Yeah.
in the political area and administration, because they're held captive to the Congress, and they have to push the Congress. I think sometimes people forget that the purse strings are held by Congress, and we need to push them on that.
And so I know for our women's health primary care providers, seeing the veteran before them 360, mind, body, soul is definitely the spirit in which our healthcare system, that's our model, and that's what we're striving for, that's what we're aiming for. And that can look like a couple of different things. That can look like making sure we do have continuity of care with our community providers, and making sure we know when mammograms are due and when they're done, and get the results in and let you know how it went. It can look like having reproductive health conversations, having preconception counseling conversations. That can happen in our primary care visits. And if someone is pregnant, then we connect them with our women's health navigator, and she kind of bridges in-house care and the community care, and making sure that we're checking in. How's that going? We provide care. VA provides care up to 7 days post-birth for the newborn as well, and so tracking that. We've got some of those things, and just and whole health is probably the other thing that you've been hearing a lot about. And so our primary care providers are keeping that in mind. Would acupuncture help here? Would nutrition help here? Would yoga help here? That program is going to continue to be expanding. And they're trying to push that out at all of our locations too. Because I know
Tell them they need Tai Chi here, because I know they have it in Vancouver, but I don't want to go over to Vancouver.
I agree. Well, I know hopefully they'll expand that. But that's what we're hearing from a lot of, I know women veterans have come to me. Part of my role also is outreach, and so I travel and go to all of these clinics. And I've been hearing folks say, it's great that you have this in Portland. What about me in the Dalles?
That's
what about
right.
me in Bend? Right?
Salem, I just was down there. They were saying that, yeah.
And so we're aware of those, but it's just part of why I really was glad to have this meeting. It's because the more I hear about the needs in the community, it helps me be able to know where to advocate and strategically what do we need, right? Because that's always what I'll be wondering, strategically what do we need? Where are women veterans? And I know right now that women veterans aren't necessarily choosing VA, right? Women veterans aren't necessarily choosing VA, right? And I think we provide great care, but I don't want to be, I don't want that to be a secret that we provide great care, or a surprise that we provide great care, Yeah. So, okay, I find myself going in lots of different directions. What am I trying to say? Okay, I was talking about the mind, body, spirit ways that our primary care providers are approaching women veterans. Because they're really the front door of working with women veterans, right? And they partner with our specialty care and that sort of thing. But the system is so huge. And so that's another thing that I do for our system, is I try to make sure everyone's aware of each other. Hey, did you know that so-and-so's working here and so-and-so's working here? And make sure folks are connected. So, for instance, we have a cancer care navigation team that looks at all sorts of different cancers that our veterans are attending to, and they have now assigned someone to look out for women veterans. We're going to start partnering them and be able to make sure that we're keeping everybody educated on the latest and greatest of what's going on, So, okay, I want to go back to some of these questions. Stop me at any point, and I'll keep going on our time. Okay. available clinic spaces for women veterans, right, is an area that I wanted to make sure I didn't miss. Because one of the other things that we've heard loud and clear, and this is nationally, is that women veterans don't necessarily feel safe coming to the VA for a variety of reasons. Right? Some of them, unfortunately, because of fellow veterans, and some of it because of staff, and some of it because of the environment itself, right? Buildings being confusing, hard to get parking, trying to sort out where to go. Like, there's some environment things, and then there's the people who are in that environment, right? Nationally, there was a research study that was done around harassment. And what they found was that about a quarter of the women veterans experienced harassment on a fairly regular basis, right? And again, from fellow veterans and from staff, from both. And it resulted in women veterans either delaying their care or not showing up for their care, right? And so in my mind, I'm thinking, wrong answer for us, right? What can we do? And so that's an area nationally, again, that we're sorting out. How can we make the space safe, right, for everyone who comes through our healthcare system, right? And locally, we've been doing that too, trying to find ways to make our spaces safe, but it's gotta be a kind of a bi-directional feedback, right? Of us letting you know, hey, here's what we're doing, and letting us know, are we missing the mark? Are there other ways, to change this? So, we've got our women's clinic, although one of the things that has come up around our women's clinic is that it's not a women-only zone, right?
There's a man there as a receptionist, and that bothers me.
Yeah.
I was very surprised.
Yeah, and that's a concern that has come up. Now, the guidelines are basically that we hire, the person who's best fit for that role, and there's not a mandate around women only in that space. Now, there's different ways that we address that, because again, I want women to have choices. I shouldn't say VA, me too, but VA wants women to have choices. So who is in your space when you're having a medical appointment, who touches you, examines you, you should have all choice in that and be able to say, I'm not comfortable with you, regardless of gender, right? We want that option to be available for sure, okay? And even talking to our front desk staff, right, is optional. You don't have to tell them anything. And I think we need to be clear on making sure that women veterans know that, right? That they're there to check you in, let your provider know that you are there, right? Address administrative things, but getting up in your business or anything like that is not part of the encounter. Doesn't have to be, right? But also, women veterans have told us, and I hope it doesn't come as a surprise, I can't imagine this will be a surprise, is that women often do like to have people come with them to their appointments, brothers, partners, friends, right? And to be able to have that choice of who they bring, children even, right, are in that space. And so it's more open than what folks might consider, but in terms of your provider, gynecologist, whoever you see there, you could say, I am not comfortable. Now, we will be checking, I should say we, but I'm not women's clinic staff. Women's clinic staff will be checking in about that too. So the onus is not on the woman veteran to have to say, I'm not comfortable, right? Because that puts pressure on a woman veteran to have to speak up, and that can be hard sometimes. Right? Yeah.
I didn't know that was an option to say that, because they also had the floor was busy one day, and a male took my complaints or concerns. I was not comfortable at all, but I really didn't think I had any other option.
Right.
Since she was overbooked or busy or something, I was very uncomfortable.
Good point.
I think that happens in a healthcare setting. I know for me, growing up, there's been a model for healthcare that you don't question doctors and nurses and that sort of thing, right? And now, now sitting where I'm at now, I can see very clearly, like, you can question everything.
Right.
But that's hard, you know, to come at that, to feel empowered to be able to do that, especially if you've, depending on how you've been socialized or raised, and plus, you know, depending on how your military experiences were as well, right, can all dictate how empowered you might feel in the moment to say, I'm not comfortable,
No.
right?
I've had that experience myself just recently.
Yes.
I lost my primary doctor, and I was given another primary doctor who may be excellent, but his bedside manners are not what I don't find it conducive for my relationship with him. He's more matter of fact, ... And I felt as though I came in there, I was annoying him. I did, you know, I'll get you, here's your prescription, take care of this, goodbye. Don't come again until you really, really, really need. Well, who the fuck is that, you know? Excuse me. That's the way I felt, you know? And so I didn't want to just, that could be a bad day. Maybe, you know, I would give him another chance, but I want a different primary care.
Yeah.
And my primary care doctor was excellent, you know.
Yes.
And he moved up in the system and went to Montana. So.
Gotcha. Oh, ouch. And you're empowered to, you know, ask for a change in provider too. But the system, I think in healthcare, not just VA.
Right,
You know,
it's everywhere, yeah.
Exactly, to not question doctors and that sort of thing. And for the Women's Health Program, we're always concerned and will be concerned about privacy, dignity, respect, safety, because those are concerns that women veterans have brought to VA. But in finding solutions around these matters, what we find is solutions that benefit everyone. Right? Seeing the person before you as a human being and caring for them compassionately helps men and women veterans. And so
plus, you know, another issue for me, I think I wrote that to you, is that I understand why, you know, women want women. I feel the same way. I want veterans, veteran to veteran, you know, because I don't feel that people that haven't been through that experience really understand how we are processing, talking about issues, and they may just think, you know, that people are playing the system or doing whatever they can, and the reality is they don't understand post-traumatic stress or moral injury, and you know, a veteran, even if they don't agree with you on something, they understand that. They understand that because they're going through it too. You know, there's a whole different kind of world there.
There is, and that actually, you know, it's interesting that you say that, because some of what I've heard from women veterans and some of my, you know, outreach opportunities is working with providers